Urticaria hives, also known as hives, is a common skin condition characterized by raised, red or pale bumps or welts that appear on the skin. These welts can vary in size and shape and may be itchy. Urticaria is caused by an allergic reaction, though it can also have non-allergic triggers. It can appear suddenly and may disappear just as quickly, though some cases can last for weeks or even months. Types of urticaria. Acute urticaria. This type of hives typically lasts for less than 6 weeks and is often triggered by an allergic reaction to food, medication, insect stings, or infections. Acute urticaria usually resolves after the trigger is removed or treated. Chronic urticaria. Chronic urticaria lasts for more than 6 weeks and can be ongoing for months or even years. The cause may not always be clear, and it can sometimes be related to autoimmune conditions, stress, or other unknown factors. Physical urticaria. Chronic inducible urticaria. This type of hives is triggered by physical factors such as heat, cold, exercise, or pressure on the skin. Examples include cold-induced urticaria, cold weather, cold water, exercise-induced urticaria after physical activity, dermatographism when the skin reacts to pressure, like from tight clothing, angioedema. This is a deeper swelling of the skin that often occurs with urticaria. It typically affects the lips, eyes, and throat, and can cause difficulty breathing. Angioedema is more serious and requires prompt medical attention. Causes and triggers of urticaria. Urticaria is typically caused by the release of histamine and other chemicals in the skin, which lead to the characteristic welts. These chemicals are often released when the body encounters a trigger. Common causes and triggers of urticaria include allergic reactions. Foods, shellfish, nuts, eggs, milk, and certain fruits can cause hives in sensitive individuals. Medications, antibiotics, pain relievers such as aspirin or ibuprofen and other medications can trigger allergic reactions leading to hives. Insect stings and bites, bee stings, mosquito bites, and other insect bites can cause hives. Infections. Viral infections such as a cold or flu or bacterial infections can trigger hives, particularly in children. Urinary tract infections or other bacterial infections can also be linked to hives. Environmental factors. Temperature extremes, cold or hot weather, sun exposure, sun-induced hives, pressure or friction on the skin, tight clothing or scratching, stress and emotional factors. Anxiety or stress can sometimes trigger or worsen hives. Autoimmune disorders. In chronic urticaria, the immune system may mistakenly attack the body's tissues, leading to ongoing hives. Hormonal changes. Hormonal fluctuations, such as those during pregnancy or menstruation, may contribute to hives in some individuals. Foods and additives. Certain food additives, such as artificial colors or preservatives, may trigger hives in sensitive people. Alcohol. Alcoholic beverages, especially wine and beer, can trigger urticaria in some individuals. Genetic factors. There may be a genetic predisposition to developing urticaria in some individuals, particularly in cases of chronic urticaria. Symptoms of urticaria: red or pale welts on the skin, which may be raised or flat. Itchiness. The hives are often intensely itchy, though they may not always be painful. Swelling. Some individuals may experience swelling in deeper layers of the skin, especially around the lips, eyes, and throat. Changing shape and size. Hives can change shape, grow, or merge together over time, often disappearing after a few hours or days. Angioedema. Deeper swelling that typically affects areas like the eyelids, lips, or throat, which may cause difficulty breathing in severe cases. Diagnosis of urticaria. The doctor will typically diagnose urticaria based on medical history and symptoms. The doctor will ask about the patient's history, recent exposures to allergens, infections, medications, and lifestyle factors that might contribute to hives. Physical exam. The doctor will examine the welts and check for any underlying triggers, such as infections, bites, or other symptoms that might indicate a more severe condition. Allergy testing. In cases where an allergic cause is suspected, the doctor may perform skin tests or blood tests to identify specific allergens that might be triggering the hives. Patch testing or elimination diet. If food allergies are suspected, the doctor may recommend an elimination diet or patch testing to identify any triggers. Additional tests. If chronic urticaria is suspected, or if there are concerns about underlying autoimmune or systemic conditions, blood tests or other diagnostic evaluations may be conducted. Treatment of urticaria. Treatment for urticaria depends on the severity, duration, and underlying cause of the condition. The goal is to relieve symptoms, reduce the frequency of flare UPS, and address any underlying causes. Antihistamines. Second-generation antihistamines such as loratadine, cetirizine, or fexofenadine are commonly used to block the effects of histamine, which helps relieve itching and reduce welts. First-generation antihistamines like diphenhydramine may also be used for more immediate relief but can cause drowsiness. Steroids. Corticosteroids, either oral or topical, may be prescribed for short-term use in severe cases to reduce inflammation and swelling. Leukotriene inhibitors. These medications can be used if antihistamines alone are not effective. They help reduce inflammation and prevent allergic reactions. Immunosuppressive drugs. For chronic or severe cases of urticaria, medications that suppress the immune system, such as methotrexate or omalizumab, may be used to reduce inflammation and control symptoms. Topical treatments. Calamine lotion, hydrocortisone cream, or menthol-based lotions may provide relief for mild cases, especially for itching. Avoiding triggers. If a specific allergen or trigger is identified, avoiding that trigger is the most effective way to manage hives. For physical urticaria, avoiding triggers such as extreme temperatures, tight clothing, or pressure on the skin may help. Epinephrine for severe cases. If the hives are accompanied by angioedema or difficulty breathing which may signal anaphylaxis, an epinephrine injection EpiPen is the immediate treatment. Managing urticaria at home. Cool compress. Applying a cool compress for a cold shower can help soothe the skin and reduce itching. Avoid scratching. Scratching can make the condition worse and potentially cause an infection. Keeping nails trimmed and using soothing creams may help manage discomfort. Loose clothing. Wearing loose clothing can prevent pressure on the skin and reduce irritation. Over-the-counter antihistamines. If prescribed, over-the-counter antihistamines like Benadryl can help relieve symptoms until a doctor can be consulted. Prevention of urticaria. While it may not always be possible to prevent urticaria, there are several steps you can take to reduce the risk. Identify and avoid triggers. If a specific cause like a food, medication, or environmental factor is identified, avoiding it can help prevent flare UPS. Manage stress. Reducing stress through relaxation techniques like deep breathing or meditation can help reduce episodes of hives. Proper skin care. Moisturizing dry skin and avoiding skin irritants can help prevent hives triggered by physical factors. Food and medication awareness. Keeping track of any food or medications that may trigger hives can help prevent future episodes. When to see a doctor. You should consult a healthcare provider if the hives last more than a few days or are recurrent. The hives are accompanied by symptoms of angioedema such as swelling around the eyes, lips, or throat or difficulty breathing. The child or person develops hives after a known allergy, e.g., bee sting, food, or medication. Over-the-counter treatments do not provide relief or the hives are causing significant discomfort. Conclusion. Urticaria hives is a common skin condition that can be triggered by a variety of factors, including allergies, infections, or physical stimuli. It can be acute or chronic, and treatment typically involves antihistamines to control symptoms and avoid known triggers. While most cases are not serious, Chronic or severe urticaria may require medical treatment to manage symptoms and prevent complications.